We got a quorum. All right. We may have some more members drifting in, but right now we do have a quorum. We're going to go ahead and hear House Bill 874 first. We've got some cardiologists and other folks that need to get back to their offices. This is a bill that came about actually this summer. I'd met with the cardiologist about AEDs. We presently have AED in law. It's in the educational section of the code. This adds to it. This defines the teams that are in schools. Most high schools already have these teams, but this really defines it much better. It does include the spectrum here from K to grammar that the original bill did just high school. I've talked to Chairman, I talked to a couple chairmen about this, and they're in favor of this, Chairman of Education and Education Appropriations. And I think it's a good idea, too. We have people that visit these elementary schools, parents, grandparents, besides the children that are there. So it's a good thing to include them, too. So I don't know, Dr. Kim, do you want to come up first, or I'm not sure how you want to do this? Okay. We did have a hearing on this during special session. Some of y'all were here. So this is a continuation. We'll be taking a vote today. This is House Bill 874 LC 339550. Go ahead.
Can you hear me? Is
Yeah.
this the mic on? Okay. Well, thank you so much, Chairman Hawkins, again for inviting me, and thank you, committee members. I remember seeing you guys about a month or so ago. So just as a refresher for this and where this came about, it's myself, my colleagues, not only in cardiology, but in pediatrics and internal medicine, recognizing that sudden cardiac arrest in children is truly a public health issue. While we don't have specific numbers in the state of Georgia, we know roughly annually somewhere between 7,000 to 20,000 children will have a sudden cardiac event while at school. And this is athletes and non-athletes, so this is even more so than just an athletic problem. If you do the math, that's somewhere around 30 cases per day across the country. There's a case of a child who has a sudden cardiac arrest event in school. We all recognize that in order to save a life, there has to be immediate recognition, immediate CPR, and then implementation of the use of an automatic external defibrillator, if the arrhythmia requires that in order to save that life. For every minute that you delay CPR, it's a 10% decrease or increase in mortality. So these are emergencies that require immediate recognition and planning that is critical. And so while I applaud the state of Georgia for already having some of these laws in place, we believe it's time to really think broadly and consider this from K through 12. And so what this proposal includes is not just high schools, but K through 8 are also having a requirement to have at least one AED present on school premise, but even more so than that, to have emergency action plan practice drills. You can have an AED, you can have a school nurse or individuals who know CPR, but unless that plan is active and people know what to do, again, every second is critical here in this process. And we know that across schools in Georgia, there are 8 fire drills per year. Thankfully, fires and deaths from fires in schools isn't so much of a catastrophic emergency that we worry about so much. And as mentioned, 30 kids every day are having a SCA event. It's far more than kids who are dying from fires, thankfully. But these practice drills, I think, is really where all of this comes together, to have 2 per year, 1 per semester, where the team that's responsible for handling these can go through the process of what to do if this occurs. And so this bill, I think, really covers a lot of important ground and will ultimately save the lives of kids in the state.
Any questions from members on the committee? Any questions from anybody on the committee? Yeah. Dr. Newton, Representative Newton.
Hey, thank you, Chairman. Thank you for the bill and for the concern. What was the number you said that are collapsing? Is that nationally or was that in Georgia?
This is nationally, and so this
30?
is around 30. And I want to acknowledge
Right.
these data come from the American Heart Association, and an average of around 30 is a reasonable. The number is about 7 to 20,000 per year. Again, these numbers come from AHA.
What, just the follow-up question, these look like great plans, and certainly, like you say, we do fire drills. These are very real. Obviously, it'll be new for a lot of our middle and elementary schools. Is there, and maybe somebody in the education department could correct me, is there any new liability that comes, let's just say the system falls down and either one of the leads is out that day, or is there any new responsibility or liability that's assumed by now them taking on this really an emergency medical role, in addition to dialing 911, but actually having a protocol that they're supposed to follow? They're doing it twice a year, you're right, with their training, if everybody's there on the day you do the training, but I'm just curious, is there any potential liability, or are schools already protected from that anyway?
I believe schools would still be protected from this. This is a little bit out of my own arena of expertise, but I think in terms of Good Samaritan, just general practice, if you have a child who has a cardiac arrest in school, that alone and just being as best prepared would take away a liability. These are not trained EMTs that are working or other. I mean, you have a school nurse, but other medical licensed individuals that are there. These are just people who are trying to appropriately respond as fast as they can while they call emergency services.
As part of that, yes.
And then obviously have EMS arrive.
I guess that would be the question I would have, and you're right, it's probably might be outside this room, is does that take away your Good Samaritan coverage that you have now for trying to go get an AED and do it by having an obligation? Does it take you out of the Good Samaritan, or can we assure the people who either volunteer for this, the 5 individuals or the lead person, can we assure them you're not taking on any new liability through this? I'd like to make sure they still got Good Samaritan protection.
Why don't we ask Legislative Council that question? Betsy, could you help us on this?
We're looking right now, but I'm pretty sure that in Title 51 it is covered for the use of an AED by essentially a volunteer or someone willing to do on their own.
Hope it is. We've been doing this for a while.
Thank you.
Okay, who else do we have? Oh, yeah. Representative.
That wasn't me. Thank you for this legislation. I think it's well overdue. With me being a certified high school coach, all of the coaches, I think I can help answer some of your questions. All of the coaches have to go through CPR and all of that every year. And most of the coaches that are on football teams in middle school and high school have to be certified in order for us to be able to coach. So if the lead person's not there, there's going to be a coach somewhere around the school in that general facilities, because we just don't coach, we also teach. And so there will be somebody in the parameters. My only question is it just going to be one?
Right. How far away is it?
Yeah, how far away? Because we have one doing athletics that's normally in the gym, and if this happens somewhere else, just having one, that might be a hindrance. And who's going to pay for it?
So I absolutely agree. I mean, I think that's a part of, ultimately you would want more than one AED. I do think, however, that we have to start somewhere, and as a part of the emergency action plan practice drills, I think that's a part of the thought process based on knowing where that AED is. And I totally acknowledge and appreciate that some campuses are much bigger than others, and that's something to work through. But I don't think that takes away the need to begin to at least, as mentioned, you have to start somewhere, and we have to ensure that every school has at least one AED, present for this. And I missed the second. You were the second.
I was like, if we're gonna have another one, who's gonna pay for it? I was just being facetious, but you can answer.
I can help you with that one. I've already talked to Chairman Dubnik for educational appropriations. We're probably looking at 75 schools at $1,500, would be $112,000. I think we got that handled.
Okay,
Yeah.
great.
Representative Sharper.
Thank you, Chairman. Thank you for bringing this bill. We've spoken briefly about it during a special session, but I have a question as it relates to liability and accountability. Being that you do have these AEDs and everything, but you also have an expiration date on the pads. Now, my question is this: if you've gone through the schools, would the Department of Health have anything to do with making sure like everything is going on? Because we need to. The buck needs to stop somewhere, so that if the expirations, if you can't use an AED with bad pads, so if you have that, somebody's going to be liable for that. So we need to have somebody that's accountable to doing maybe a check off of that machine, and that's going to be very critical.
That's absolutely a part of the EAP practice drill and a part of the team designation. It's vitally important that not only do you have a team lead, a CPR lead, but an AED lead, not so much the person who's going to use the AED, because really anybody can.
Exactly.
But the person who follows with the maintenance. Is the battery still working?
Mm-hmm.
Importantly, where is the AED? And have that kind of, whether it's probably a couple people as a part of this team, a response team per school that would be responsible for ensuring that those dates are kept knowledge, or people are knowledgeable of these dates, so that those can be addressed.
Okay, thank you.
Okay, seeing no more questions, we have some people who want to speak to this. Bethany Norris, would you like to come up and speak?
Good afternoon, Mr. Chairman, committee members, and guests. I'm honored to share with you my experience of the importance of AEDs in this bill. My husband and I have 4 children, but I want to tell you about my youngest daughter, Audrey. I want to take us back to May of 2021. Audrey was a 7th grader who had finished her first year as a cross-country runner for her middle school team. The week before, her teacher asked for volunteers to run the long-distance run at field day, and Audrey volunteered. She had run 5Ks. She was excited to be able to run for her 7th grade team at school. We live in Upson County, which is a small district in the middle of the state. And for field day, the middle school students walk across the street and use the high school football stadium. The student athletes take the field while the rest of the students sit in the stands and watch the events below. Audrey was bouncing with excitement that morning as she entered the field, according to the school nurse who saw her as she walked through the gates. The day had all the signs of being a fantastic one. The weather was gorgeous. Audrey had on her favorite Good Luck shirt. And because my husband and I are both teachers, we were unable to go to the event. But her teacher assured me that she was going to film Audrey and send me the video so that we would not miss out. I was in my classroom teaching at the high school when her teacher called me that morning. I ignored it, thinking it was a pocket dial. I figured she meant to send me a text about Audrey and accidentally hit the call button. Then she called again, and this time I answered, thinking maybe Audrey skinned her knee. I can still hear the panic in her voice perfectly. Audrey fell. We need you here right away. Get Matt. My husband is also a teacher at the same school. I assumed Audrey had hurt herself when she fell, and she was upset and needed me. Even though she was in middle school, she still needed snuggles. I asked if she was going to the hospital because her teacher said it was so serious and we needed to get her there immediately. She was sobbing as she told me, Bethany, her heart stopped beating. They're doing CPR. They're calling for an ambulance. You need to get here right now. I raced out the door to the assistant principal's office next to my classroom. I have to go, I screamed. Audrey's heart isn't beating. Before she could talk to me more, I ran down the hall to my husband. Grab your keys, we've got to go. It's Audrey. My husband did not ask questions, but grabbed his keys as we ran out of his classroom. The secretary came running to us. Go now, we got this. Audrey's heart has stopped. At that, my husband sunk to his knees and started crying my baby. I don't know how I managed it. Maybe it was surge of strength that comes with adrenaline, but I pulled him up and I yelled and we had to go. I grabbed the keys, we made it to the football field. When we arrived, it was like a scene out of a disaster movie. There were flashing lights, uniformed emergency crew, teachers, administrators, people from the district office. I don't remember putting the car in park as I ran onto the field and yelled, "Where is she?" The rest is a blur. There were worried and devastated faces. There were hugs, there were words of sympathy, and there was my baby in the back of an ambulance, unconscious and intubated. They told us that she had collapsed when she was running. When they got to her, she didn't have a pulse. Someone started CPR, someone else yelled for an AED. The AED was locked in the field house on the field, and only high school staff had access to that building. The middle school had not brought an AED to the field, but by some sort of miracle, one of the football coaches was a middle school teacher in the self-contained classroom, and he had said this was a good morning to bring his students out to field day. His last-minute choice gave the middle school keys to grab the AED. When they placed it on Audrey, the machine immediately said to administer a shock, and her heart was back. The ambulance came shortly after. The EMTs intubated her and waited for the life flight to take her to Scottish Rite. We arrived before the helicopter, and we told we couldn't fly with her, but we could meet them at the hospital. We sprinted to the car and drove to Atlanta. The nurses told us she needed to stay intubated overnight. They would do tests on her brain to see what damage had been done. That first night, she started to wake up. She was thrashing, trying to pull the tube out of her throat. My husband and I jumped in with some of the nurses and held her down so she could be put back under. When she was calm again, one of the nurses looked at me and said, "I know that was hard, Mama, but she was mouthing your name. That's a good sign." All I could think of was how none of this seemed real, and I just wanted to wake up from the nightmare. The next day, one of the nurses asked if it would be okay for some additional doctors to come in the room during rounds. Audrey's brain scans looked great. She had no permanent damage from the cardiac arrest, and the doctors want to talk to you. I had seen enough medical shows to understand what rounds look like, but I was not expecting what happened that day at Scottish Rite. The room was packed with medical staff. It was standing room only as people kept entering her room. One of the doctors thanked us profusely for allowing additional people. We don't get very many happy stories here. Audrey's a miracle. Everyone on that field did everything perfectly. That's why she's here and healthy. He told us that less than 10% of people who survive a cardiac arrest outside of a hospital survive with brain damage. He credited the first responders on the field that day for saving her life by giving her immediate CPR, by administering an AED. The doctors had the easy job, he assured us, because the staff at her school did the hard work of saving her life. The additional doctors wanted to be present in Audrey's room to see what recovery looks like when everything goes right. Our district said they felt that they had the correct safety protocols in place, but Audrey's near-death experience was a wake-up call for them. They changed their emergency plan so AEDs go out with all school field days. They make sure that all the elementary school teachers are CPR certified. They increased the number of certified staff in the other schools, and they ordered more AEDs for every building. When I asked about that decision recently, I was told that they didn't consider the price of the AEDs because the life of a child is priceless. Those safety changes made us have a peace of mind as parents when it came back for Audrey to return to school for 8th grade. We're lucky there was an AED. We're lucky that there were people trained in CPR when Audrey had her cardiac arrest. But it shouldn't be luck. It should be protocol. We know better than most people that most at the time that time is critical when it comes to cardiac emergency, and every single second counts. Having AEDs and cardiac plans in place increase the chance of survival. Cardiac issues can occur unexpectedly and to individuals of any age. You cannot predict the future, but you can certainly influence the outcome. Thank you so much for giving me this time.
Thank you for your story. Stinson?
Yes.
Yeah. Representative Stinson, I'm used to. Go ahead, Bentley.
Yes, no problem. Thank you, Mr. Chairman, and thank you. I'm sorry I didn't get the mother's name. Thank you for sharing your story from Upson County. I'm down in Taylor County, so thank you. Thank you. My question is relating to the middle school. You mentioned the middle school. You mentioned the middle school didn't have access to the AD.
No,
It was only the high school. So is that normal protocol? Can you explain that to me more?
It was the high school field house where the field day was. We had walked across to the field day, and They said it was not protocol at the time to bring out an AED for field day. No, it is now, but it was not at the time.
Okay. I would like to talk more offline because I want to find out from my schools in my district what protocols they have in place for something like this. So again, thank you so much for sharing your story, and blessings to you and your family.
Thank you very much. Richard Lampkin, is that correct? Yeah.
Thank you, Mr. Chairman, and members of the committee. My name is Richard Lamphere, and I'm with the Georgia Nurses Association. And I'm also a member of the Project Adam National Council Advisory Board that oversees 42 programs across the country in 32 states. That what we're talking about today is exactly what we do. I also used to run the program here in Georgia at Children's Healthcare of Atlanta. I've since retired and now am with the Georgia Nurses Association full time. So to answer some of the questions that I heard, we're in full support of this, and I just want the committee to know that we're willing and available as a nursing association to help implement this law if it's passed, or hopefully when it's passed. We're able to do that across the state. We'll be able to help the schools make sure this is implemented appropriately based on certain national standards that we've set at Project Adam, the American Heart Association, and the Red Cross. So one of the things that I heard is, when we do a practice drill, that I can tell you so many stories about doing a practice drill. My favorite story about doing a practice drill is they wanted the students to be involved in this practice drill. We want an AED to the victim in about 3 minutes. They wanted the students to be involved, so they sent a senior to go get the AED. They pulled the cabinet, and it's hard when you pull one of those AED cabinets, it's hard. He came back and said, the cabinet's locked. The teacher said, no, it's not, you have to pull hard. It took 8 minutes to give that practice drill shock off. They changed one thing on 13 of their AEDs in the school district. It said not locked, pull hard. Because they learned that in a practice drill, not in an emergency. And to the representative's point, is this done in schools? Is this the standard to take an AED with you to field days? That's part of this. When they do a practice drill, and we recommend in the spring to do one outside, they're going to find out that the AED at the field house is locked. How are we going to get that? We tell coaches, if it's you who's gone down, where's the key to get that AED out? Do your athletes know how to run and get that AED and get it to you as quickly as possible? We have this, we have this in the high schools. We've always wanted it to be in elementaries and middle schools as well. An elementary school story I can tell you, a grandparent on Grandparents' Day went into cardiac arrest. The school saved him, and what a difference that story is. Grandpa came to see me at school to have lunch with me. He died. What does that do to a child? Or Grandpa came to school, he got sick, he went to the hospital, and he came back next year to Grandparents' Day. That's what this law will do. It will give the opportunity for these people who go into cardiac arrest, and this is just a rough estimate over the last 10 years, probably about I retired about 2 years ago, but the previous 10 years, we had about 25 to 30 cardiac arrests that I knew of in Georgia schools. We don't know where it's going to happen. We know it's going to happen. And when we have these practice drills, in the schools that we have these practice drills in, 90% survival rate. You heard earlier that 10% survives out of hospital cardiac arrest. When we have a practice cardiac emergency response drill, that rate goes up to 90%. Just because it doesn't cost that much to do this. It takes about 30 minutes of school time, of teacher's time, so we're not taking any student learning time out of it. We just have that small group of 5 teachers or 5 volunteers of staff that is doing this, and so we know that it's going to, it's such valuable information that they learn in a practice drill. My other favorite one is up in Cherokee County. The assistant principal said, okay, our team's going to meet in the lobby, then we'll go to the victim. We put a mannequin down. 2 people ran past me to go to the lobby, and everybody said, okay, now let's go to the victim. The assistant principal, and I didn't think that was a very good idea, but it's their drill, it's their plan. Let them practice it. Let them find this out. So he came back and said, well, that doesn't make sense. We'll all just meet at the victim. but they learned that because they practiced it. They didn't learn it in an emergency when seconds really do make a difference. Thank you.
Thank you, Richard, and I appreciate that testimony. I think everyone knows healthcare providers, physicians, dentists, nurses, every 2 years we have to take CPR and AED training for our license. So those of us that know about this still practice, because in the time of emergency, sometimes your mind can go a little bit blank and seconds count. Thank you. Up next, Karen Surio. Am I pronouncing that right? I hope. Georgia Association of School Nurses.
Good afternoon, Mr. Chairman and members of the committee. I appreciate this time to be here today to say that as a member on the board for Georgia Association of School Nurses, that we are in full support of this bill. We understand as school nurses the importance to have people who are trained to know what to do in those emergencies, as well as to have the tools available to them that is going to give the victim the greatest chance for survival. I know that people are speaking numbers. I don't have those numbers, but I can say in the time that I have been a school nurse, I do know of a couple of cases, one in Clark County where there was a student that had been saved by an AED, utilized 6 shocks, saved his life, and is still here today to speak, and with no residual effects or any type of brain damage. We also had a teacher in the school district in which I work that was just saved last spring on the playground because someone ran and got the AED and people knew what to do, and there were people that are trained for that emergency response. The practice portion is extremely important. Without practicing, when that moment occurs, you need to have muscle memory to understand what your roles are and what to do. And if we just put, oh, you're going to do this, you're going to do that, but we don't actually practice it, we won't have people that will be ready at that time.
Thank you. Okay. All right. That concludes the testimony. We have an amendment, but I'd like to hear a motion to move the bill first. Second. Okay. If you look in your packs, we have an amendment, and that is on line 47, after plan, to add that it adheres to a nationally recognized standards. And everyone see that? Okay. It's on line 17 of the bill. Any comments, questions? Do I hear a motion on the amendment? All those in favor? Aye. All those opposed? Now to the main bill. All those in favor? Aye. All those opposed? That's the first I've seen that. So this is another amendment? Okay. Is this in their packet? All right, we need to back up. I just was told about a second amendment on line 58. I think this comes from Legislative Council. Yeah, the Legislative Council. This should probably be 2025-2026, which would match line 28. Do I hear a motion on this amendment? Second? All those in favor of? Aye. Okay. Going back to the main bill, do I hear a motion? Second. As amended. All those in favor? Aye. Amended. All those in favor? Aye. All those opposed? All right, the bill passes. All right, thank you very much. All right, Chairman Powell. House Bill 809, LC 339509.
Thank you, Mr.
Floor is
Chairman.
yours. Floor is yours, Mr. Chairman.
Well, good afternoon, Mr. Chairman, ladies and gentlemen of the committee. I bring to you today House Bill 809. This would make a minor change in the scope of practice for occupational therapists. This would allow them to do dry needling. And I don't need to tell the committee what dry needling is because I didn't know a whole lot about it. I just thought acupuncturists did that. And I've subscribed to acupuncture in the past. That's the reason I ran for the House and not the Senate 30-something years ago. But dry needling is a recognized form of therapy. And the genesis of this bill came that some of the occupational therapists, those who specialize in working with hands and things like that, have been doing a certain amount of limited dry needling. When they approached their licensing board, the licensing board went to the AG's office, and AG said that this needs to be changed by the legislature, since acupuncturists and physical therapists are statutorily allowed to do that. If you'll look down through the bill, it's really kind of tracks what physical therapists and rules of other states, but it establishes following requirements. They got to be certified to use physical agent modalities to the tune of about 90 hours, must have a minimum of 3 years clinical experience. They must complete coursework in dry needling, which can be done by an approved program with a minimum of 26 hours postgraduate instruction, 20 of which must be in person for upper extremities, with an additional 20 hours for the lower extremities, and then obtaining documented informed consent from the patients that they do these procedures on. This is basically, as I said, very simply changes the scope of practice to allow dry needling for occupational therapists.
Okay. Any questions? Somebody's got to have a question for him. There you go.
Okay. Yes, sir.
Can you press your button? I don't have the light blinking. Yeah.
There we go.
Thank you.
I kind of missed a little bit what you were saying. So you're saying dry needling, this is something that acupuncturists and other people actually do now?
Licensed physical therapists and acupuncturists. And this would allow occupational therapists to use this type of procedures.
Okay. And why would I missed why they would need to do it? Why do they need to do that?
Because the law doesn't allow them to do it.
I know, but why do they need to do it though? Why would
I don't think that you want people sticking needles in you. You know, we've got enough people to stick needles in dolls of us, but you know, this is actually something that's pretty serious, and they need to be with all the credentials that they need to be educated on what they're doing.
Well, I realize that, but what are they doing? I mean, they can't do it now, so what are they doing instead? I mean, they're not doing that now, so what are they doing instead of doing that?
Mr. Chairman, I could clear that up a little bit.
Go ahead, Tom, if you want to speak. Speak on that mic.
I think your question is two-part, and if you want to know the technical or the medical reasons, Rob McClellan is here.
I wouldn't understand that.
But actually, this is something that a handful of occupational therapists have already gotten this training and certified, but it was sort of in limbo, and so the licensing board asked the Attorney General whether these people could be doing it, and he said, well, no, they really need to have it listed.
Tom, can you speak into the mic?
Oh, I'm so sorry.
No, it's okay.
Should I start over?
Now, somewhere in the middle is fine.
Okay. As I was saying, there are a handful of occupational therapists who have been doing this, and they're certified. They're fully certified to take the course that would be in. And the licensing board really didn't know what to do with them, and so they approached the Attorney General.
I got you. Okay, I see.
Representative Newton.
Thanks, Mr. Chairman. So now this is done by physical therapists already. We don't need to, they've already got permission to do this, is that right? And then occupational therapists are trying to get you functionality back to where if you've had an injury or burn or whatever, they're trying to get you to where you can do your occupation or do your daily activities of the day. So this is just a modality that lets them do something, and it's not all of them, correct? It's only a small portion that have had the training and that had the 3 years minimum, the number of hours needed. Okay, so it just lets some that have a kind of a special technique that they think has worked for their patients it allows them to legally do it. Okay, thank you.
Mr. Chairman?
Fantastic.
Mr. Chairman.
Any other questions?
It's not working. All right, it is on.
Okay.
All right. I just wanted to say to you, I had never heard of dry needling before until I got sciatica. And they use dry needling as a technique to be able to relieve some of this pressure on me. And I go back routinely to get that done. And so, again, I want everybody to be properly trained. I felt comfortable with the people that were trained to do this, but it was something that worked for me.
Thank you.
Thank you, ma'am. Seeing no other questions, do I hear a motion?
So moved.
Second?
Second.
All those in favor?
Aye.
All those opposed? Congratulations,
Thank you,
Mr.
ladies and
Chairman.
gentlemen. This is the easiest health committee meeting out there.
We try to make it that way.
Gosh, I
House
sure
Bill
did.
809 just passed with
sure did
LC
like that.
339509.
Mr. Chairman. Mr. Chairman.
Representative Golly, this is House Bill 870, no, excuse me, got the wrong one. 576 LC 339233. Go ahead.
Thank you, Chairman, members of the committee. This is House Bill 576, LC 339233. Like many of you, I've witnessed firsthand the profound impact of our healthcare decisions on our real lives. It's a responsibility that I think we all carry with great care, and it brings me here today to present this bill. Representative Rick Williams, now Senator Rick Williams, passed legislation that some of you might remember. Gracie's Law, a landmark bill passed in 2020, has since played a crucial role in ensuring fairness in organ transplants for those with physical or mental disabilities. While the 2020 session was only 4 short years ago, a lot has changed in this world since then. I think few of you would dispute that COVID has been a major catalyst for these changes. In these 4 years, as we navigated the unprecedented challenges of the COVID-19 pandemic, we've seen firsthand its far-reaching effects on all aspects of our lives, especially healthcare. This bill is our response to this new reality, where we seek to expand upon the spirit of Gracie's Law by ensuring that COVID vaccination status is not a barrier to life-saving medical treatment, such as an organ transplant. Decisions, especially in matters as critical as organ transplant, should be based on comprehensive assessment of individuals' risks and not a vaccination status. By passing this bill, we not only uphold the values of equity and compassion in healthcare, but also adapt our laws to the evolving needs of our society. I think it's a step towards inclusive and empathetic healthcare system. And that's what this bill does. It just adds one of the discriminating factors that you cannot use is the COVID vaccination status for a organ transplant. Happy to answer any questions.
You do have a question, Mike 8, I don't know who that is.
That's me.
Oh, okay.
Yes, sir. I wanted to ask you, what grounds can they refuse to do this currently? I mean, you're saying this is one of them that they're, is this actually a problem?
Yeah, it is a problem. There's a guy in Cartersville actually was on the organ transplant list, got removed because he didn't get the COVID vaccine. Argued a little bit, got added back to the back to the list. But in the American Journal of Transplantation, 2022, they did a survey of 141 unique transplant centers all throughout the United States. It showed that 35.7% of the centers reported implementing a vaccine mandate. And most often they cite administrative, equity, and legal considerations for their decision. What's sad to me is that they don't consider patients' health in those 3 things that they consider. So, yeah, it is happening.
Well, if I may, well, couldn't it be argued, though, that in making that decision, that someone who has been, I mean, if there's people on a list or something, that they're lying, couldn't it be argued that people that have been vaccinated would be more likely to have the use of that organ transplant than those who have not been vaccinated, who haven't taken the time or the trouble or whatever to go get vaccinated?
Well, I mean, I think it depends on your own health care. So say you didn't get vaccinated now, and say you need something, say you need an organ transplant, say that's still a vaccination requirement. Do you need to go get a COVID vaccine now at this point in order to get that organ transplant? I mean, I think that's really depends on at the time of, healthcare decision and vaccinations. I'm not sure, especially I think a lot of people, I got vaccinated, but I think a lot of people saw that it became political. And it became, it became political. I think a lot of people thought it was experimental. With what's it called, mRNA? Some people didn't get it for a variety of reasons. But should they be subject to not being able to get an organ transplant because of that decision? Then,
Well, can I ask one more question? I'm sorry. Well, can it also be argued then that if we pass this legislation, it'd be sending a signal to people that we don't think vaccinations are important?
yeah. So I don't believe that at all. So I believe this is just saying that a person's healthcare decisions is based with them, and because they maybe didn't get involved in the political, or experimental nature of what they believed COVID vaccination was, that they shouldn't be penalized not to be able to get an organ if one's out there. So.
Thank you.
Mhm.
Representative Maybe.
Thank you, Mr. Chairman. Good bill. I'm very appreciative that you did this. In my clinic, I had people losing their jobs because they didn't take the vaccine. So it's very disheartening to know that somebody that it's a life or death situation to be able to get an organ transplant, to be denied that. I'm just proud that you did this bill. Thank you.
Thank you.
Okay.
Chairman Hawkins.
Seeing no other questions, we
We got
have two
one.
people to speak to this bill.
Just-
Oh, I'm sorry, I didn't. Can you press a button?
Yes,
don't
I
have
think
any-
I'm good. Thank you, Mr. Chair.
Okay.
I would equate it to DOD, basically let a lot of our service members released from the military, Army, all across all services because of the lack of a COVID vaccine shot. And then a year later or so, they asked them to come back. Half of them hadn't joined, and now the services are experiencing massive losses of recruitment. So I can see where this has a role in that.
All right. We have two people signed up to speak. Victoria Cruz. Victoria Cruz? Okay.
Good afternoon. My name is Victoria Cruz, and I'm from Athens, Georgia. Good afternoon, Chairman Hawkins, member of the House Health Committee, and Representative Gillette. Thank you for sponsoring this bill. Thank you for allowing me to speak in support of this bill, which seeks to prevent discrimination against individuals needing organ transplants based solely on their COVID-19 vaccination status. After 4 years now, 4 years of experience, research, investigations, with all of the information that is currently known about the lack of efficacy and high incidence of serious adverse side effects of this vaccine, it's hard to believe that medical establishments and other entities continue to penalize and demonize those who choose not to subject themselves to it or who have valid religious and medical objections to vaccination. Those are not being considered or in employment. I have some familiarity with this problem, not on a personal level, but a dear friend of a close friend of mine from Ohio came very close to death from end-stage heart disease, heart failure, because he was being denied a heart transplant due to his refusal to subject himself to this experimental gene therapy injection alleged to be a vaccine against SARS-CoV-2 infection. To be absolutely clear, this was an intelligent, relatively young man with end-stage heart failure who refused to get a vaccine that has a high rate of adverse cardiac side effects, including myocarditis, pericarditis, and sudden cardiac death. Fortunately, as a last resort, he was able to receive a mechanical device which is keeping him alive, but he is still denied a spot on a transplant waiting list, and his life depends on whether he has constant access to electrical power or charged batteries. His life is extremely limited because of that. Why did his physicians not recognize that the vaccine might exacerbate his native cardiac problems as well as possibly damage a newly transplanted heart? Why would it not? If it can hurt a heart that is normal, it can hurt a transplanted heart. It's really unbelievable to me. As a physician, who took the Hippocratic Oath, I am disgusted that something like this is happening in our medical community. There was arguably no pandemic, and the misrepresented vaccine as currently deployed offers little but the risk of death or severe side effects. And then when I say currently deployed, I mean forced, mandated for populations who are not at high risk of death or severe disease from COVID-19. These are young people. These are children. And just the fact that we were talking about defibrillators in schools, this is, yes, it's a wonderful thing. It's a life-saving thing, and I would highly recommend it. But I can't help but believe that somehow the rollout of the vaccine for children in May of 2021 had some effect on the need for cardiac defibrillators in elementary schools now. That's a total another discussion. This is just my feeling as a physician. This madness for the financial gain of pharmaceutical companies must stop. It really must stop. Thank you.
Stephen, I'm sorry, I'm having a hard time reading your last name. Alesky or?
It's fine. Is this on?
Yeah. Yeah.
My name is Stephen Elshire. I also live in Athens, Georgia. I'm remarking on this bill 576, which I do support. I am a physician, medical doctor, a pathologist, and I am board certified in multiple subspecialties. Based on my age, you can tell I have extensive knowledge and experience in pathology, and I also received the COVID-19 vaccine ×2. This bill is too narrow in its scope. That's my complaint. It limits the definition of vaccine to that associated with COVID-19/SARS-CoV-2. It needs to be broadened to include all vaccine platforms that employ gene editing or manipulation technologies, including messenger RNA, mRNA, CRISPR, which you may or may not have heard of, and micellar structures employing lipid nanotechnology. The mRNA product and associated nanotechnology cause vasculitis, inflammation, and myocarditis, also inflammation of the heart, a fact that is now widely known in real medical literature. Both the resulting spike protein from the COVID-19 vaccination, but also the lipid nanoparticles themselves directly cause vasculitis and myocarditis, further contributing to heart failure both in transplanted hearts as well as native hearts, for example, of an organ recipient. Newer vaccines are now in development using mRNA and lipid nanoparticles as delivery vehicles, so-called platforms. You may have heard of them that both of them are now in development in influenza as well as respiratory syncytial virus, which is recommended for a lot of people. These are now being migrated to these newer gene editing technologies in preference to older traditional methods that you have gone safely to the drugstore and received. They have an established safety profile, but the newer ones do not. Vaccines for other diseases, including so-called disease X, will follow. Any vaccine released under emergency use authorization, so-called EUA, should be considered suspect because of their unknown side effects, much like the COVID-19 vaccine. I support the bill in principle, but the definition of vaccine needs to be broadened to include all these genetic editing or rewriting technologies as I described. Gene editing technologies will soon become ubiquitous. You will not be able to get the traditional ones, and these should not prevent a person from receiving life-saving care, including organ transplantation. The bill, as currently restricted to COVID-19, will easily be circumvented. Thank you.
Okay, thank you, sir. You have a question.
Oh, sorry.
Representative Newton.
Okay, thank you, Doctor, for your experience. I know we're not here necessarily debating everything about whether vaccines on balance are good with the risks.
I'm
and
not
with the
trying to do
benefits.
that. I'm just trying to broaden the definition.
For just and I do think there are some out there regarding directed specific individual cancer therapies and things like that, that it might be interesting to use some of those potentially, but certainly up for debate among the medical community. This is really just about the discrimination potential in organ transplants. A very, very, very narrow number of Georgians. I don't know the total number of Georgians that get a transplant every year, but this is strictly limited to them, not whether other people or the military or any other entity can or should. That's not the scope of this bill. This is just saying that it shall not be used to keep you from getting on a list or lower you on the list. Okay, so it's pretty straightforward. So, well, thank you. I'm sorry. Thank you for your.
Well, I'll just,
think I understand.
to amplify, pretend that someone is on an organ transplant list, or they're, about to be, and they find out that they don't have the vaccine for disease X.
So a future disease that has another
Right.
vaccine. I see what you mean. Well, thank you, sir.
To the sponsor, go ahead. Would you like to make a comment?
Sorry. No, I don't have anything to add. Just wanted to, answer any questions there are. But it is, like Dr. Newton said, narrow scope. Thank you.
You're welcome. Do I hear a motion?
Chair Hawkins, excuse me, may I just make a comment?
You're not on the list, but are you talking about a 2-minute comment?
No. A 15-second comment.
Oh, 15 second, I'll do that. Go ahead.
Thank you, sir, I'm so grateful.
Come speak to the mic.
The work of this committee is so vital, and I fully support the efforts of Representative Gullett. And may I just draw your attention to an email that I sent to this committee last night. If my phone hadn't died, I would read it to you, but there is a very important bar chart in that email that shows the increase in the number of deaths and rate of deaths in the age group 15 to 44 from 2019 to 2020. And then you would think when the COVID vaccine came out in December 2020 that the number would go down, but the numbers are increasing. My husband is an actuary, and we're just looking at this. So the rate of death between 2019 and 2020 in Cobb, particularly Gwinnett, Fulton, DeKalb, it's startling. So if you will look at that email, I ask that you look at that, and what I'm asking for is, number one, for you to support Representative Gullett's bill. When there was an issue at Emory, I reached out to Representative McCormick, who intervened, and he was able to get Emory to change their policy impacting a 40-year-old mother with 6 children who was being denied the transplant. So thank you for letting me to speak, but if you would please look at that email, I would be so grateful. We need legislation to know why, access to de-identified public health data to understand why people in the age group 15 to 44 are dying. That's the throwaway age group for group life insurance, and we shouldn't see the alarming rate of increase in death. Thank you.
Thank you. That was for succinct.
Because we're getting hundreds and hundreds and.
My name is Julie Allen.
Thank you.
And in the subject line, it says something about Fulton County.
Thank you.
So thank you so much.
Julie, I'd like to talk to you.
Thank you.
Do you have a comment from Emory?
Real quick, sorry.
Quick.
Yes. Sydney Wilkins from Emory. I just wanted to clarify that in the case that's alleged, we can't comment anything because of HIPAA, but we never denied a kidney transplant because of COVID. While we strongly encourage all of our transplants to get both influenza and COVID vaccines, we absolutely never said no to the transplant because of that. So
That
just
was a
wanted to
good
clarify
comment.
that. Thank you.
Thank you. I've got a blinking light. Do you have something else to say? No.
I do not.
Okay. All right.
Chairman, if we have a discussion, I just have one thing I'd like to say.
Yeah, go ahead.
Okay. I'd just like to say is, I think it's, some of you know, most of you know, I lost a daughter to COVID, and like probably many of you, I lost several friends to it back in the height of the COVID. So I have a strong bias in favor of the vaccinations, and I don't believe a lot of these things are said about it. But with that being said, at this time, I would like to ask you if I can be recused from the vote. I have that bias. It wouldn't be right, I don't think, at this time anyway, for me to vote on the bill.
You may. And thank you for your comment. Do I hear a motion? Do I hear a second? All those in favor say aye.
Aye.
All those opposed? Your bill passes. Thank you. Thank you, committee, for all your work and good questions.
Todd, you don't apologize. You could be, you got hung up in DBH TV.
Thanks.
Adjourned.
This meeting's concluded.